Thank you for tuning in to the Into the Classroom series produced by Mental Health California, sponsored by Blue Shield of California's Blue Sky Initiative.
Greetings, everyone, and welcome to our session of Into the Classroom, which is a student mental health awareness multimedia series produced by Mental Health California. I'm your host, Conrad Crump, also known as Coach Crump, and for today's topic, we'll be talking about understanding and managing test-related stress. Now, I'm looking forward to a beneficial discussion today where we'll explore the topic of students and the stress of taking tests. Join us as we dive into the challenges that students face when it comes to these test-related anxiety situations and the impact that it has on their academic performance and their well-being. We'll look at some effective strategies to manage test-related stress, including study techniques, mindfulness practices, and self-care routines. Some of our students will also share their proven tips for how to deal with test-related stress. So let's begin with this insightful conversation. Before we begin, I'd actually like to introduce our guest for today. Today we have with us Ali Garza, who is a licensed clinical social worker on faculty with the Department of Psychiatry at the University of Colorado. Ali has expertise in youth suicide prevention, crisis intervention, supporting parents and families, and treating OCD and anxiety-related disorders. Ali, good to see you. How are you today?
Doing well. How about yourself?
I'm doing fantastic. Good to see you. I'd also like to take the time to introduce our youth guest for today's episode. Today we have with us Michael Betlak, who is a Brother Be Well contributor and student at Sacramento State University. And today, Michael joins us as a youth mentor to our younger guests and listeners. What's good, Michael? How you doing?
Good evening, Coach Crump. I'm doing great. How are you doing?
Doing good. Good to see you again.
Yep.
Awesome. And we also have with us Erica Pham from Mira Loma High School. Greetings, Erica. How are you?
Hi, I'm good. How are you?
Doing pretty good. And we also have with us Monica Tamayo from UCLA. Hey there, Monica. Good to see you again.
Hello, good to see you, and thank you for having me.
Yes, indeed. And last but not least, we have with us Meant to Be Craig, a student at CK McClatchy High School. Hi there, Meant to Be.
Hey, Coach Crump.
Hey, good to see you again.
Good to see you too.
So now, before we just jump into our discussion, I'd actually like to take the time to ask Ali, our clinician, if she could provide some brief clinical insights into the pressure and stress that youth often experience when preparing for taking exams.
Yeah, absolutely. I always like to preface these types of conversations about specifying the difference that I would say anxiety or stress is a universal experience. Everyone pretty much experiences it to different degrees. Everyone has mental health. What everyone doesn't necessarily have is an anxiety disorder or a mental health disorder. And so when it comes to stress or anxiety around testing, that's fairly common. What we're looking for in the field is at which point it becomes debilitating or impairing. And I think certain aspects about test taking, especially the anticipatory anxiety piece, the buildup to it can be especially challenging to manage. Another piece as far as like how grades or scores reflect upon one's identity can be a really big piece, and also some of the external pressures that come along with academic performance. And then along with that, some avoidance tendencies that can also come into play that can amplify that stress or that anxiety around test taking.
Wow. Yeah, no, thank you for that analysis, Ali. That's great. Now, I don't know about anyone else. I mean, I can guess, but I know that me personally, I used to be terrified at just the thought of taking a test in school. Whether it was Scantron or whether it was written, my anxiety was through the roof. Now, I know I can't be the only one. So, by a show of hands, has anyone else on the call felt this way? Okay, see, I'm not alone, and you're not alone either. And I'm sure there are many folks in our audience watching this right now, raising their hands saying, yep, me too. So let's go ahead and look at our presentation to better understand how to manage test-related stress. Now, Ali was able to give us an overview of some of those types of stressors, identity and how it can create that pressure externally. But as we look to better understand this topic, I'd actually like to ask some of our youth participants who are currently probably dealing with this right now. And as we can see from our slide, there's different types of, types of test-taking strategies and stress forms that often come. But I'd like to ask, let me start with you, Michael. When it comes to the anxiety and the stress from taking tests, can you kind of elaborate on what you're feeling in those moments?
Yeah, I mean, it's kind of perfect timing because I just had a midterm earlier today, as well as another one tomorrow, so I'm right in the thick of those feelings and, that process up to, test day. It was pretty crazy when Ali mentioned the anticipatory buildup, because I was feeling that all day today. I woke up feeling a little anxious, just wanting to get it over with. And, as time gets closer and closer and closer, it's like, your heart starts thumping and you just want to get in and get it over with. No matter how much you're studying for it, there's always still that little bit of stress that you feel, or that little bit of anxiety that you're feeling throughout that build up towards it. And so I was feeling that this morning. After I get off this call, I'm probably gonna start feeling it again, while I'm studying for the next one. So, but yeah, I mean, it's pretty normal, but it can be manageable.
Wonderful. Thanks for that feedback, Michael. I'd like to also ask some of the other participants here. So, Erica, might you be able to talk to us about what you're feeling and some of that experience that you feel with anticipating an exam?
Yeah, for sure. I'm like right in the middle of my international baccalaureate exams right now. And I think it's just really stressful, and it caused a lot of anxiety because it's crazy how all of the studying that we've done over all these years comes down to like what we can put on a piece of paper and what we can like remember in just like one moment. So it's kind of really overwhelming, but also it's like a chance to prove what we learned too. So that's another way to look at it as well.
Yeah, it's clearly a significant source of stress for students, both in college and in high school that we're hearing. It can be overwhelming, and I'm hearing that from both you, Michael, and Erica. Let's go ahead and move on to our next slide. So when we talk about the physical, mental, and emotional effects of test-related stress, we know that there can be so many different types of reactions that our body is going through, whether that's an increased heart rate, whether that's sweating, difficulty sleeping, whatever those feelings might be, even mentally, with negative thoughts and so on and so forth. These are all related to the feelings of that anxiety that comes from kind of what Erica talked about, of like how it all comes down to being able to what we can put on this piece of paper. I'd like to ask our clinician, Ali, here, if you can maybe talk to us a little bit more about some of the physical, mental, and emotional effects that, this stress kind of brings from tests.
Yeah, absolutely. I think stress and anxiety has a function, right? When, way back when in humanity, when we were being chased by a wild animal that was trying to attack us, those same symptoms would come on, those same sensations. And now in 2024, we have those same symptoms and somatic experiences coming up with anxiety provoking situations, whether it's test taking or something in which you are physically in danger. I think some of those symptoms are not necessarily things that you can avoid. In fact, sometimes the more you try to avoid them, the worse they get. But rather just understanding that this function is trying to help me get the adrenaline or kind of try to get the energy or the motivation to get through this, and be aware of when it's becoming unhelpful or debilitating. So I think especially things that come to mind of what can make it worse, right, is like too much caffeine or too little sleep, and all these things that also tend to go hand in hand with test taking and studying, unfortunately. So things to keep in mind when you know you're already kind of susceptible to these things.
You raised a great point. The aspect of getting enough rest, that is like really key. And I remember specifically being told, make sure you rest, because your brain is working and your brain needs the time to actually relax and absorb the information that you've been studying upon. Let's go ahead and go on to our next slide, because it kind of actually segues into some of those physical effects, because as I mentioned earlier, there's different types of effects that can happen to us before the exam, right? The physical effects of, like I mentioned, difficulty sleeping, the mental effects of having negative self-thoughts or self-doubt, or even the emotional feelings of the irritability or feeling overwhelmed. I'd like to ask, maybe I'll chime over to some of our youth participants. Let me ask Mintabi, how do you feel before going into an exam?
I guess for me, it depends on what the exam is. And sometimes I feel very excited, like I'm ready, like I'm going to do well. Other times I'm like, I don't know how I'm going to do. I'm just afraid that I might not know what's going on. I don't know what I'm ready for.
Sure. Great. And how about you, Monica?
I feel like no matter how much I study for a particular test, I'm always going to feel anxious just because it's called a test. And then in addition to that, we mentioned the physical aspects that come out of the stress taking. I feel like whenever I know that a test is coming up, I coincidentally always get sick, but it's because I feel like I am like my mind is not at ease, and that stops me from having a good night's sleep. And it's just like all this like anxiety that I create for myself because I know that I've studied enough. Just all of that plays a part into how I feel taking the test, which again is always me feeling anxious.
Wow. Yeah, I mean, from what it sounds like, there's a lot of pressure that students are facing when it comes to taking a test. We feel it before the test, and going into our next slide, we actually also feel it during the test. And, oftentimes at this time, those feelings that we've felt in the beginning, leading up to it, actually can intensify. Our rapid breathing, maybe feeling sick to your stomach, or even having a full-on panic attack. Those are some of the physical aspects, as well as mental, like having a hard time recalling some of the information that you just studied, whether it be 5 minutes ago or 5 days ago, what have you. Concentration starts kind of being scattered. And then emotional, of course, that frustration, disappointment, those are real feelings that are actually in our bodies and making itself manifest during the exam, which is really tough. I want to get our clinician in here and just kind of ask you, Ali, if you maybe can have some thoughts or reactions to, what and how our bodies respond, both from before and during our exams.
Yeah, I think the piece that I saw for the before slide, and also this one, is especially on the cognition level, noticing when we're getting caught up in those negative, distorted thinking patterns. I think there's this unique challenge that comes up with being hard on ourselves or saying negative things about like how we should have tried harder, we should have done better, or we should fill in the blank. That feels really productive for some reason to be hard on ourselves, rather than practice self-compassion. So I think especially in the midst of a test, that is an opportunity like none other to be like, I see these patterns coming up, I see these symptoms coming back up, and I'm going to redirect my attention, not try to shove everything away, like almost trying to push a beach ball underwater, but rather redirect my attention, as tempting as it is to kind of go down that rabbit hole, to what I'm doing right now. That doesn't necessarily mean you have to be saying things that are the complete opposite of like, I know I'm going to ace this test. It's like, no, there's a level of uncertainty that comes with test taking. That's why it's anxiety provoking. But rather in this moment, when these feelings are high, when I'm feeling the panic, I'm going to redirect to, and this is what I'm doing next. This is the next question. That's all I can do is my best right now. So
Very good. No, thanks a lot for that. And of course, as we know, even after the exam, these effects can linger. So let's go ahead and go on to our next slide. And I'd like to ask Michael, can you talk to me about some of the feelings that you feel after you've taken the exam? What comes up for you?
Usually a sigh of relief, to be honest, to just know that it's finally done. Don't have to worry about it, a feeling of accomplishment as well too, because just because that test might be a 50-minute slot in your day, they don't take into consideration all the time you put into studying, the time and effort that you spent listening in class, actually gathering the notes. So there's a sense of accomplishment as well there for me when I'm done with the test, but also, still feeling anxious, waiting for that test to come in, because I think it was Monica, she mentioned, like, no matter how much you study, it's still a test, and still just having that label on it, it's a sense of you never really know until you know. And so even after, if you've studied, you feel confident, there's still that level of anxiety that I tend to feel as well.
Yeah, and I want to ask you too, Monica, and I asked you and Michael first because you're both currently college students. With your experience being in college versus being in high school, because college, as I understand it, is not necessarily like you have to be there or you're required to be there, because it's all on you, right? I mean, if you choose to show up and take notes, great. If you don't, not so great. I mean, again, it's all on you. So maybe, Monica, if you can kind of talk to me about how you feel after an exam, and what comes up for you as well.
Yeah, so after the exam, I also feel like that sigh of relief. And I just tell myself in order to stop worrying about it, because I feel like back then it would just stay in my head like, what did I pass? Did I not? But lately I'm just like, if I passed, I passed. If I didn't, then worrying about it isn't going to change the outcome. So I try to just tell myself like, it's going to be a learning experience. So if I pass, that's great. I'll keep doing what I did in order to pass. And if I didn't, then I can see like how I could improve it for the next time. So I'll just take everything as a learning situation.
Very good, very good. And let me ask, our folks that are in high school, Erica, can you talk to me about maybe like after you've had an exam, some of the feelings or your response or where your head is at, or maybe how you're feeling emotionally or physically?
I think after a test, the first thing I kind of feel is definitely just a sigh of relief that, like, yes, it's over. Now I can get sleep. Now I can focus on another subject, or now I can do something else. But I think another aspect of it is since we are in high school, like, we're so close with our classmates. I think the first thing that a lot of us tend to do is also go and talk and be socialized with our classmates to like know what the answers were, check what that is. So that also I think causes some anxiety in that sense. Um, and I think that's just like another aspect of just being social and talking to a lot of people about it after.
Wonderful. Thanks for that feedback. And meant to be, I don't want to leave you out. So please feel free to chime in on some of your thoughts and feelings of how, after the exam is over with, what comes up for you.
Erica pretty much covered it. It's a big sigh of relief, and yeah, that anxiety about hearing your classmates like it was this answer, and you're like, oh, it's probably not that answer. I don't know if I put that. So same situation going on.
Okay, very good. Well, thank you all for that feedback. It's very important. And I know that there are some folks listening on the call, in our audience right now that will definitely kind of take note of that and can probably even identify with a lot of the things that you've just said and just mentioned. So thank you all for that. Let's go ahead and move on to our next slide. So we want to talk about tips, tips and strategies for taking tests. That way we can share some ideas, some things that folks in our audience right now might be able to pick up on or might even affirm. So let's go ahead and go on to our next slide as we talk about some tips and strategies. So here we have preparation. I heard a saying a long time ago that proper preparation prevents poor performance. Clearly, we have here on this slide starting early, getting that time to give yourself enough time so you're not waiting till the last minute, having a study guide or a study plan, something along those lines. Another thing that I believe it was Erica, you mentioned is collaborating with students. And that's something I would also maybe add as another tip, is just maybe having kind of like a study group, forming a study group. I found that to be super beneficial, because a lot of the things that I may know, I can kind of help affirm and pour into other folks, and something that I might need to brush up on, someone else can kind of help me on to help me get better prepared. And of course, practicing with past exams. Definitely want to keep those, at the ready, so that way you can always be sharp on what might come back. Let's go ahead and go to our next slide. So test taking strategies. Obviously you want to read your instructions on your exam carefully. You want to make sure that you're giving yourself enough time, whether it's for each question or for each section, and, go for what you know. Answer those easy questions first, so you can just kind of get through them and give yourself more time for the more difficult questions. Let me ask Allie, are there any other test-taking strategies that you might want to add in or throw in, or some thoughts about the current ones we're seeing right now?
Yeah, absolutely. I mean, as I was reading them, because I specialize in working with folks with anxiety and OCD related disorders, I'd also say the flip side is also very true. I have a lot of folks who find themselves ruminating on questions, or kind of sitting with things too long, questioning themselves, and actually getting their anxiety amped up because they're not willing to move forward. I think that can also kind of go hand in hand with answering the easy questions first. But for example, when it said like read the directions, I think it's a spectrum, right? And some people might really have challenges, especially those with like executive functioning challenges, with not reading things thoroughly. And I know folks on the other side of the spectrum with anxiety and OCD related disorders who will read it over and over and over again, to the point that it's taking away the time. So it's figuring out what are kind of those tricky spots for you. What are the patterns in which you find yourself getting caught into some anxiety provoking situations and some distorted thinking, and plan ahead. I also really appreciated the last slide about doing similar testing. I think there's an element of exposure in that, of just getting yourself used to something as much as you can in a situation in which there isn't a lot of control, because it's a test, like everyone said, right? And it comes with not knowing all the things, which is very distressing, especially with anxiety in play. So.
Wow, no, very good. And thank you, Allie, for that information. Super helpful, super wonderful tips that can definitely be applied. But I want to ask some of our youth participants that are here with us now, and I'll go with you first, Mintabi. What are some strategies that you use for test taking when it comes to, whether it's getting prepared for your exam, going into it and leading up to the exam? What does that look like for you, that process?
For starters, I do the thing where I go through the questions, and whatever one is easiest, I try to do that one first. That way I'm, maximizing on my time. Second to that, if you're taking a multiple choice test, I try to do the process of elimination, try to suit what best fits with what I have studied previously. And that's just about it.
Okay, no, that's great. Those are great tips. And how about you, Erica?
Yeah, just to add on to what Mintabi was saying, I think another thing that I do when I take tests is I like mark up the questions. So I circle the words that are important. I basically just outline the way I'm thinking, so that even if I don't get the exactly right answer right away, or I have to come back to it later, I can pick back up on like the thought process that I was having, or just rethink through like what I was thinking and how I got there, to like check my question over again or something like that.
Awesome. Great. And I want to ask some of our college students now. I'll start with you, Monica. What are some test-taking strategies that you've used from high school? Maybe some things that you do now, maybe differently now that you're in college, and kind of talk to me about your process.
Yeah, so honestly, in high school, I didn't really have that many test taking strategies or like studying. I feel like we kind of just went into the test without studying. At least that's how it was for me. it wasn't until college that I found out the hard way that you have to study for these college tests because they're way different from your high school tests. And then I started seeing a trend in my classes where the professors, they want you to pass the test. So they'll give hints during the lectures like, oh, this question's on the test. So make sure you highlight that in your notes. And then sometimes professors will even give you study guides, like maybe 2 or 3 weeks before the exam. So for example, they might give you like a 50 questions study guide, but maybe only like 25 of those are going to be on the test. But regardless, it's better to answer them all and just study those questions. So I've done that. And then when it comes to taking the test, I do like a quick overview of all of the questions so that I can pace myself. So if I have like 2 hours and like maybe 40 questions, I'm like, okay, so I can spend like an hour on 20 questions and so on and so forth, and the essays, of course. So I pace myself in the beginning. I go through all the questions. Sometimes I have like these thoughts in my head that I'm just like, let me write that down before I forget it. So I'll quickly write it down. If I see like a hard question, I will skip it and I'll come back to it because sometimes that question is answered in another question because it kind of gives you like the hints. So that's just what I do to get through tests.
Very strategic. Very strategic. I like that answer. Very good. And let's go with you, Michael. Talk to us about some of the strategies you employ leading up to a test. And this can be for any test in any assignment, whether it's your SAT, whether it's, just all tests in general. Talk to us about it.
Yeah, I find that what works for me is just setting a routine of your before test type of like preparation. You got to find what works for you best, and you just need to give yourself adequate amount of time to actually study and to maintain the material. I feel that I tend to do best when I put as much time into the preparation as I possibly can. I try to do everything that is under my ability. Anything that I can control, I try to make sure that I control it so that come test day, I'm hitting on all the questions. Like Steph Curry don't look so good on game day shooting from threes for no reason. Like he's particular with his routine and his shooting, and it's repetition after repetition after repetition. And I found that for me, it's the same. I put in a lot of work. Whether it's Quizlet or just reading over notes or reading a summary of a chapter. It's just whatever you can that you have under your control to make test day as easy as possible.
Absolutely. And Michael, I love the analogy because you're absolutely right. You get what you put in, so if you're definitely putting in that time, you're definitely doing all those steps that we've just heard, as well as, just preparing yourself properly with rest and all of those other things that you need to do, it's definitely going to benefit you. Another tip I would just add is that for my college students and also my high school students, maybe not so much high school yet, but it will be something that will be advantageous for you when you do get to college, is office hours. I would definitely recommend taking the time to visit your professor, having just a brief conversation with them about the subject material or something that you might have a question on, something that you might not understand, or something that you know very well, but you might want to ask a question about. So it gives you the ability to talk about it. Those are also strategies because that relationship with your professor, they might be able to elaborate more in class about an area that you might find difficult or challenging. So definitely building that rapport with your instructor or your professor is key as well. And that's a huge piece of the preparation element. I want to go to the next slide and I want to talk about self-care. Now, when we talk about self-care, I see we're talking here about sleep. We've talked about sleep, but it also talks about exercise. I'd like to know what some of your self-care regimen might include for some of our youth folks and just kind of see how that might be beneficial to you. So I'll start with you, Monica, and then I will pick as we go on.
Yeah, for me, for my self-care, I like to go to the beach and just relax. I don't necessarily like to have something very like I guess, exciting. I really like to keep it peaceful. I'll take a book with me, just read on the beach, or sometimes just go for a walk in the community, hang out with my friends, like have lunch together, have a coffee in the morning, just things, little things like that. That for me is self care.
Okay, no, that's great. And how about you, Meant to Be? What are some of your self-care practices?
Conditioning my mind that positively, like saying positive affirmations and just making sure I'm staying grounded. That way I won't go into things with a panic mindset, or I won't go, if I don't prosper in the way that I want to, I won't freak out about it and it reflects back on me and who I am. No, I just keep it together.
No, that's really good. No, thanks for that, both of you. Let's go ahead and go on to our next slide. A huge part of self-care is also your nutrition. I want to get our clinician in here. Allie, can you talk to us about the benefit of eating nutritious meals and some of those ways in which it can help us, and as well as some of the self-care tips that we can also utilize?
Yeah, absolutely. I think all of these different elements are just creating a well-rounded effort in order to put yourself in the best position possible. And I think with that, there's really not perfection's not always attainable or ever attainable, really. And so I think sometimes with these practices, like I saw with the muscle relaxation and with nutrition and exercise, absolutely, these are all things that are important. I think sometimes folks can get kind of taken into all or none thinking with that and being like, either I have to do a 45-minute run or nothing at all. And I think that there's ways to incorporate all these things, even if it's just small snippets. Even if you can't do an entire meditation or some sort of mindfulness practice, can you be willing to take a 5-minute break, a 10-minute break to do something small? Because those small things go a long way. I think similarly with nutrition, are you willing to commit to taking a break, even when it's going to be really tempting to be like, I should just keep studying, to like drink water? I know that sounds simple, but I think most people have been there, that, and when the anxiety is high, sometimes those things are out of sight and out of mind. So
Wonderful. No, those are great tips. And, I think on a previous show, Meant to Be, you talked about yoga and breathing. And I think that's a huge piece as well, right? Just having the opportunity to kind of just like get yourself in calm and relaxed. So we've heard some great things today, you all. We've had some great ideas from our young folks and their experiences. We've also had great feedback from Allie. I appreciate you, and I want to thank you for taking the time to lend some insight and wisdom as well. I'd also like to thank our guest, Meant to Be. Thank you so much for joining and providing your insight. Monica, I'd like to thank you as well for taking the time. Erica, good luck on those exams. All of you, good luck on your exams. Michael, it's always a pleasure to have you on a call. Again, managing test-related stress, looking at those ways we can just really put ourselves in the best position to succeed. So again, with that, I'd like to thank everyone here. Again, I'd like to also thank our audience for joining this Into the Classroom session, which is a production of Mental Health California. Please be sure to visit us at mentalhealthca.org. Also, to access health and mental wellness topics for boys and men of color, please visit our signature initiative at brotherbewell.com, and please be sure to subscribe to our blog. I'd also like to give a special shout out to our sponsor, Blue Shield of California's Blue Sky Initiative, which promotes access to mental health support. You can learn more about their program at bluesky.blueshieldca.com. And with that, I'm your host, Coach Crump. Wonderful having this session with you all. Until next time, take good care of yourselves. Thank you.